You know, riding sports tend to be pretty common for clavicle fractures. We do see them a lot from skiing, snowboarding, any sport where you're at risk for falling with your hands out in front of you to protect your head basically. You're at risk for a clavicle fracture, and I guess that's evolutionarily that's an advantage because you'd rather break your clavicle than your brain. It's really controversial. Nobody really is exactly sure what to do with the clavicle fractures in the say 14 to 18-year-old range of ages, because they're not quite adults, but they're not really little kids either. And we know little kids heal very reliably with minimal problems, even in some of the worst clavicle fractures with a lot of displacement. Adults, there's some emerging evidence that there are certain adult clavicle fractures that we should probably more aggressively fix with plates and screws or whatever devices people like to use. And then there's sort of that in-between age group where there's not a lot of research. So we've recently published a study that was really just a survey of pediatric orthopedists, really trying to hone in on what people's preferences are. So that's not necessarily to say that we know what the right answer is. It's just more to see what people are doing and what their biases are, because we don't have a lot of scientific information about that. And what we recently found was amongst pediatric orthopedists, so these are orthopedists that are used to taking care of the children up to young adults, that even in the worst clavicle fractures and in high-level athletes, the recommendation for most doctors was to fix only about 50%. Only about 50% of them recommended operative fixation of even the worst clavicle fractures. So I think this illustrates one of the problems with clavicle fractures that we don't understand. We don't really know how to predict which clavicle fractures that we see that happen today or yesterday are going to go on to be ones that become problems in the future. And so there's certainly a subset of clavicle fractures, especially the really bad ones, and depending on the activity level, that probably should be fixed with an operation, but the majority will do just fine treated non-operatively. Well, I think with, in general, you see almost everybody wearing helmets these days, and I think helmets can prevent a lot of head injuries, especially for people that ski in the trees and kind of in the backcountry. As far as snowboarders go, we see a lot of wrist injuries from snowboarders because obviously they fall on their two hands, and wrist guards and wrist protectors are very helpful in preventing some of the snowboard-related wrist injuries that we see. As far as the ACL, commonly injured ligament in the knee, we don't really know a great way to prevent injury to that. Bracing doesn't seem to make much difference. Probably preseason conditioning and just being in shape and having strong muscles and skiing with the proper form and knowing how to fall correctly are the best things you can do for your knees. One of the biggest things, especially after you've had surgery, is appropriate rehab and strengthening the muscles around you. For example, after an ACL surgery, the first few months of an ACL surgery are just spent getting the range of motion back and the swelling down and letting the new ligament attach into its new position. Usually the second few months afterwards are really spent getting the rest of the knee back in shape, getting the muscles stronger, kind of reestablishing the neurologic connections between the brain and the knee, and improving muscular control and things like that. So that's really important after an ACL surgery. And that kind of goes for a lot of injuries as well. There's a lot of deconditioning that happens after an injury and then after surgery, and there's a lot of time off. So really doing really good rehab and strengthening, and then going back slowly, because your body's not ready to go back to the same activity level that happened right after your injury,
right.
Right at the end of rehab. So you got to slowly, progressively return, rather than pick one day and you go from nothing to everything. A lot of the injuries we see from some of these competitions are a lot different than what we see from, say, the soccer field. Those tend to be twisting, lower energy injuries. The injuries encountered in these extreme sports tend to be almost more like what we see coming out of car accidents and things like that, because a fall from 20 feet is significantly more energy than say twisting your knee on the soccer field. So the injuries tend to be bigger and tend to lead more towards fractures with some of these really high energy athletes.